Thank you for joining us today. My name is Shelley Gast, and I'm the System Vice President of Managed Care and Payor Strategy at Norton Healthcare. To begin the Hangout, I will present a brief presentation about the Affordable Care Act and health insurance marketplace. That also includes plans that include Norton Healthcare hospital facilities and employed physicians. I invite you to ask questions using the Q&A feature with the Google Hangout. You can access the Q&A feature by clicking the image that looks like small boxes in the upper right-hand corner. Please feel free to post questions as I am presenting. I will answer as many questions as possible following my brief presentation about the healthcare marketplace. Finally, if you have any questions about our plans or your personal situation, I invite you to reach out directly by emailing insurance@nortonhealthcare.org. This email is also available in the Google Hangout description. So let's start the presentation. So understanding the healthcare marketplace. The Affordable Care Act was enacted back in 2010 in order to create affordable, accessible healthcare to all Americans. Key changes that have occurred since the Affordable Care Act. One important thing is that children can stay on the parent's plan until they're the age of 26 years old. Another is guaranteed coverage for all children under the age of 19, and those include those with pre-existing conditions, and that's very important. Preventative screenings are covered at 100% in network. And that's, again, very important to make sure that you understand that those preventative screenings have no out-of-pocket to you. So understanding your coverage is very, very important. Some of the tax penalties for those that choose not to have insurance or not to pick a plan. In 2014, for a family household maximum, it was about $285. And in 2015, that penalty increased to almost $1,000 for a family maximum, or 2% of the household income, whichever is greater. So you can see that tax penalty is beginning to increase. There are 10 essential health benefits that must be covered in all plans that are covered on the healthcare exchanges. And those are ambulatory patient services, emergency services, maternity and newborn care, pediatric services, including dental and vision, rehabilitation and habilitation services and devices, mental health and substance abuse, preventative and wellness, hospitalization, prescription drugs, and lab services. And how to buy your health insurance. Again, there are several avenues that you can go through. Open enrollment it's open right now. So it opened November 15th and it goes through February 15th. So you can go through several avenues to obtain your insurance. You can go directly to an insurance agent. You can contact the insurance company directly, or you can go through the health insurance marketplace or the exchange. The exchange itself, again, it's an online marketplace where families and individuals can go to purchase or compare their insurance. Not only the benefits, but also the cost. And these are state-by-state ran. So in the state of Kentucky, you would go to the state-ran Kynect site. And in Indiana, you would actually go to the government-ran site. So you can see there that the Kynect, kynect.ky.gov is for your Kentucky residents. And the Indiana federal exchanges, or the Indiana residents would use the federal exchange, which is Healthcare.gov. So how does it work? First of all, you would go on to the marketplace and you would create an account. And they're going to ask you for a lot of information. And when you fill out that information, you're going to submit your application. Once you submit your application, depending on the application of what you submitted, it's going to come back. So in Kentucky, it's kind of a one-stop shop place. So when you submit your information, if you qualify for Medicaid, it will throw you into the Medicaid payer opportunities. But if you don't qualify for Medicaid, it will then give you the individual marketplace payers, and you can then choose your individual plan on the marketplace. In Indiana, it's really just an exchange product. So you're going to go to the Healthcare.gov for your exchange product only. But you would then submit your application, pick a plan, and then enroll. How to compare your plans. Again, people will talk about the metal levels. So there's platinum, gold, silver, and bronze. And for example, the platinum plans, it's more of a higher premium to you, higher monthly premium, but also they have richer benefits. and it's less out of your pocket once the benefits are utilized. So it's more of a 90-10 coverage. So the insurance will cover 90%, where you would then have to cover 10%. Unlike the bronze level, where it's a lesser monthly premium to you, but it's a high deductible plan. So when you utilize those benefits, it could be a $6,000 high deductible plan. And so you'd have to pay that $6,000 before the insurance would kick in anything. And then it's more of a 60-40. Insurance pays 60% and you pay 40%. So again, that information would be submitted once you submit your application, and that information is shown back to you. You can go in and look at those benefits and look at those costs and try to pick a plan that best fits your needs. So now we're going to talk about coverage from Norton Healthcare. Individual plans offered on the exchange in Kentucky. There are 5 payers out there: Kentucky Health Cooperative, WellCare, Anthem, Humana, and CareSource. And Norton Healthcare participates with all of these plans except a few individual Humana plans, and we'll talk about those. So again, the ones that Norton does not participate with, there's Humana Louisville HMOX, there's a St. Elizabeth plan, and a University of Kentucky plan. And those are plans that Norton Healthcare does not participate with. The plan that Norton does participate with from a Humana perspective is called Norton Plus Just for Kids. So when you're out on the marketplace, you can see the description there. Once you submit your application, this information, it will look similar to this on Kynect site. And if you're looking to search for a physician provider, you can click on the Humana icon, and once you click on that, you can see the drop-down information, and then you can kind of search for your provider to see if they're participating. Some of the Medicaid products out on the exchange in Kentucky, if you're prompted to choose one of the Medicaid products that participates: Anthem, Humana, WellCare, Coventry, and Passport. Norton Healthcare does participate with all of those plans. Now switching gears to Indiana. Plans offered on the Indiana exchange. There are 4 payers: SIHO, MHS, Anthem, and CareSource. And Norton does participate with all the plans on the Indiana exchange listed above. So again, if you are Indiana, you have to choose your plan based on the state in which you live. So if you live in Indiana, these are possibly some of the payers that would come back and offer you a plan. And again, Norton is participating with all the plans shown here on the exchange. So I'll stop with that. Right here. And go to any questions that you might have. Once again, thank you for joining us today. If you have any questions, additional questions, feel free to reach out to us directly. You can email insurance@nortonhealthcare.org or submit your questions at nortonhealthcare.com/health insurance. Thank you.